Hi, everybody. I'm Danny Rosen. I am actually a professor in social work, and I'm really excited to be here today to talk about what we've done at Wellbridge Health and how we've really focused um, on what we refer to as the 5% of patients at over 50% of healthcare costs. And I've heard there's been a lot of references today about why does the United States have the worst outcomes with the highest healthcare costs. And I'll be very clear. It's a very simple answer. It's because we focus all of our spending on healthcare and not on addressing the social determinants of health and the social services that individuals are going to need and the supports that they're going to need to be able to effectively manage their chronic disease. And what we do in Wellbridge Health is we say that healthcare happens between visits. And as the doctor mentioned earlier, this 30-day window or come back in 3 months, that's when all the challenges happen. And that's when all the problems occur. And is there a way to have a more high-tech, high-touch approach with high-risk patients to begin to manage some of the issues that they're facing? And what we've done in Wellbridge, and I'm going to show you a little bit of our outcomes and also the way in which we do it, is we found a way to be able to interact with patients on a daily basis, both with some self-reports, remote patient monitoring, and also to provide the health education that leads to behavior change so that patients can be successful. And we are able to measure outcomes on both the patient side and on the cost side to show the efficacy of this approach. And what we do is customizable, and we can do it with many different types of patient populations. What you see here in this image, and I'm going to go into it a little bit more, is one of our master's trained health coaches interacting in a HIPAA-compliant video chat with a patient. I'm going to talk about these interactions because what we have found is that doctors, nurses, they don't have the time to teach patients how to manage their chronic disease in a 15-minute office visit. And we're able to use this type of platform to really do the important information of teaching people what are the symptoms you need to look for, what are the things that you need to be aware of, and then we can show the outcomes of this type of approach. And so we've been able to incorporate into our telehealth protocols all the things that impact HEDIS and star ratings. This is how health systems get reimbursed, but they also make a lot of sense in improving someone's health. So understanding care coordination and all the different pieces that goes into someone's care, understanding medication adherence. We sit with a patient and ask them to take out their medications, and that's when we learn that they're not taking certain medications because they can't afford them, and they didn't know that as a Medicaid recipient, they'd actually be eligible to have that reimbursed. We learn that they're taking both the generic and the brand name medication because they didn't understand because they're taking 10 plus medications, and that's why they keep getting dizzy and falling. And we've been able to show very significant outcomes in decreasing emergency room visits, decreasing avoidable hospitalizations, and also because of my background, we've incorporated behavioral health issues into everything that we do in the management of chronic disease. And so we've published on these outcomes. We've had very successful trials where we've been able to show that for the most at-risk, socially isolated, people who are completely cut off from the healthcare system, that we're able to improve their knowledge around managing their chronic disease and to actually change their behavior. And working with our partners, we've been able to demonstrate a strong return on investment for healthcare systems that are able to do this. So we've been able to show a significant reduction in hospitalizations, reduction in ER visits, and of course that translates to cost. And so a 30% reduction in overall costs of care. These data that I'm sharing with you are using the claims data from the healthcare companies. They run these analyses to show the efficacy of what we're doing. And again, there's a cost to what we do from a business model. We've been able to demonstrate to them a 6x return on investment. With every dollar they invest into Wellbridge, we're saving them $6 on the care side. So again, we started with the big disease states that you've heard about here. We started with congestive heart failure. We started with COPD. We started with diabetes. And now we have telehealth protocols for a range of disease states. We integrate addressing mood and anxiety disorders. We've had demonstrated that for individuals who are quite sick, they're often very depressed. Depression is a barrier to care. It's actually the number one risk factor for heart patients to go back into the hospital. Our master's trained coaches are able to screen for that. They're able to address it, and we're able to show a reduction in depression scores. And of course, that we focus on the wellness activities that people are going to be able to engage in to be successful. For many of the patients that we work with, exercise might mean getting off the couch and walking around the living room once, and then the next day doing it twice. Many of the individuals we work with they've never worked with someone in the healthcare system in this way. And we just had one of our patients say to us, I love working with Wellbridge because it's the first time in the healthcare system I don't feel like garbage. So I thought that would be good swag and a good t-shirt for us to have. And so here you see a sample of one of our health coaches talking with a patient. And I want to be very clear. These calls happen once a week. They're HIPAA compliant. They're video chats. Most of healthcare is still using telephones to reach out to people. No one answers their telephone. The patient sees the same health coach every single week. They develop an empathetic, caring relationship. For patients to have Bluetooth devices in their home that ding, and they don't know what that means, and they don't know the results of that, and they don't know why, for a patient with congestive heart failure, that they're beginning to gain weight, why that's so important. It means they're retaining water, their hearts aren't functioning. They now have someone they know is going to be looking at their results and that they can trust. And it's these interactions that really make a difference. You can see things in a video chat call that you can't see on the phone. You can see mood and affect. You can see labored breathing. So we're able to get a lot of health education available through that mechanism, but we also gather a lot of information. So they teach people how to self-manage their conditions. We focus on keeping people out of the hospital and the emergency room. No patient wants to go back to the hospital or the emergency room. But most importantly, we're able to intervene and have patients get the right care at the right time. And this is the way we do it. We have a I usually say very elegant, a very simple app. Many of the patients we work with are medically illiterate. In this example, we're using a patient who has congestive heart failure. We've taught them the importance of checking their ankles. That's where they begin to retain water. We use very simple wording. They're filling this out every single day. It takes less than 2 minutes for them to do. If for some reason they forget to do it, then we send an automatic text message, and we have very high compliance. There's about 10 screens related to their chronic disease. It's customizable. We can, if someone's comorbid disease state, we can add in different disease states, and it gives us a tremendous amount of information. We're also, the API in the back end of our dashboard, which I'll show you in a second, allows us to incorporate any other type of device that's in the home. And that dashboard daily allows us to see which patients have changed from their baseline. So the back-end algorithms we have in our dashboard that our coaches are monitoring. So this allows us to scale, because for this patient population, we can't do home visits. We would never be able to scale at the level that we've been able to demonstrate that we can scale, but we can see on that change from baseline, if someone moves into yellow, of course, if someone moves into red, and it allows our coaches to reach out right away, because that way, that's how we prevent people from going to the emergency room. Because if someone ignores what's happening in their ankles and then they begin to retain water in their lungs and they feel like they can't breathe, they need to go to the emergency room. So the question is, how do we get to it before that? We can, of course, dig down into each patient. We're able to gather a lot of information. We're able to look at trends over time. We're able to see where there might be more focused health education that we could do. We're able to talk about these things with the patient. And this is the main thing that has allowed us to really scale and to really able to demonstrate some of our results. From our dashboard, we can provide reports back to our customer. We can customize them in the way that's most useful for them. So we've done over 35,000 of these video chats to date. I like to say we were doing telehealth before COVID. And because of that relationship that we're able to develop with the patient, we have a 90% adherence and retention rate on our platform, and that's over a 6-month time period. So we're able to really do that work so that someone's learning and they're eventually graduate. And again, this is a focus on, we're not providing medical advice to individuals. We're talking to them about, what do you need to understand? What do you need to do? What are the lifestyle changes you need to make to be able to be healthier? And again, this is all customizable. We found that patients don't just fall into a narrow bucket. And it's very easy to get started. We partner and support care teams. Everyone knows about the crisis in healthcare now and the workforce issues. So we're able to really support existing care teams within managed care organizations, within accountable care organizations, within health systems. We're able to focus in on patient populations that they've had trouble addressing and working with. And we focus in often, because of what the health system is interested in, on high PMPM members, high per member per month costs. So patients who are costing the system a lot of money. We share the risk because we have a lot of confidence that we know now what we're doing really makes a difference. So we're super interested, and I'm going to be around after this and talking with systems that are interested in incorporating this type of approach and working with us to really scale this to the next level that would really demonstrate some of the outcomes that I'm talking about. So thank you very much. It's great to be here. I appreciate it.